In San Elizario, Texas, located in El Paso County, residents lack safe, potable water. Water and mosquito-borne illnesses are rampant here as a result of poor drainage, pooling sewage, and water contaminated by leaking septic tanks. 98% of the town's residents are Hispanic, and 40% of families live at or below the poverty line. The situation here is a manifestation of environmental racism, in which low-income earners and people of minority racial groups are disproportionately exposed to environmental pollutants. However, San Elizario is just one town in a network of impoverished communities along the U.S.-Mexico border known as Las Colonias. The U.S. Department of Housing and Urban Development defines a colonia as a community within 150 miles of the U.S.-Mexico border that lacks one or more of the following: a potable water supply, adequate sewage system, paved roads, or sanitary housing. In 2005, Texas was mandated to create a classification system for colonias based on their health risks. Approximately 47% of colonias are classified as either red or yellow, indicating that they lack access to major basic human needs, such as potable water and sanitation. This color coding system helps with the proper distribution of public funds, so colonias in a more dire situation receive assistance first. However, many colonias remain unidentified. A limited supply of adequate, affordable housing along the Texas-Mexico border has increased the number of overcrowded and unsafe residences. Most residences in colonias have plywood walls, dirt floors, lack electricity, plumbing, and other basic amenities. Inadequate water and sanitation infrastructure, coupled with the lack of affordable housing along the U.S.-Mexico border, is creating widespread illness. There are cases of both dengue fever and Lyme disease, carried by mosquitoes and ticks. There are high rates of asthma and bronchitis, stemming from a lack of waste collection. Public health departments also report rates of cholera, hepatitis A, salmonella, and dysentery in colonias that have severely exceeded the U.S. average. Colonia residents endure third world conditions despite living in a first world country. These inhumane living conditions are putting as many as 400,000 people living along or near the U.S.-Mexico border at risk. The affected population is composed entirely of Mexican immigrants and their families, who are either unemployed or rely on seasonal work for their income. So, most affected do not have health insurance and never receive treatment for their health problems. In 2010, Texas state funds were allocated towards improving infrastructure in colonias, but with increasing border regulations, no meaningful changes have been made to improve the health of San Elizario residents. The conditions along the border are arguably a humanitarian crisis. Action needs to be taken to improve the lives of Hispanic families living in these border colonies. The most successful form of healthcare in colonias has been promotoras, Spanish-speaking volunteer nurses who go door to door offering free medical advice. States with a high concentration of colonias, like Texas, should invest funds into training promotoras and equipping them with basic medical supplies. They have the power to bridge the gap between Hispanic communities and the U.S. healthcare system. However, to create long-term change, the U.S. government should provide partially subsidized healthcare coverage to colonia residents and allocate funds towards the development of sanitation systems and affordable housing along the U.S.-Mexico border. Together, we can improve the health of Hispanic families living in border colonias.